Live.
Good afternoon, everyone. I'm Tate Baeza, Director of Exhibitions here at the National Center for Civil and Human Rights. Thank you so much for joining today's conversation, where we're taking a close look at the disproportionately high maternal and postpartum mortality rates for Black women in the United States. I'm joined today by Dr. Robin L. Jones, MD, and Angela Aina, MPH. Robin is an assistant professor of obstetrics and gynecology at Rush University Medical Center. She serves as chair of the Illinois Department of Health Maternal Mortality Review and is clinical lead of the state's Birth Equality Initiative. A native of Chicago, she continues to work in her community as co-chair of the Westside United Care Coordination Group, among numerous other projects related to healthcare equity in pregnancy and childbirth. Angela is co-founder and executive director of the Black Mamas Matter Alliance, where she works to convene Black maternal health professionals and community-based organizations to develop training, programs, research projects, and Black feminist advocacy strategies to advance maternity services and public health policy. She has over 14 years of public health experience, including working on teams that are addressing major public health crises, such as Zika and Ebola, and has been featured in Huffington Post, The Atlantic, Time Magazine, and CNN. Welcome our panelists. Thank you so much for joining us today.
And thank you.
So I think, Robin, I'll start with you. I'd like to allow both of you, so I'll start with both of you in this way, a chance to really tell people more about what you do than that sort of short list I read. Robin, you work in obstetrics and gynecology, providing care and education to patients and students. You also work, as I mentioned, in the Perinatal Quality Collaborative. Will you explain what you do in this collaborative and what the collaborative is?
I'm going to answer, first of all, thank you for the invitation. To have dialogue around such a thought-provoking, meaningful subject is a privilege and an honor. So thank you, first of all.
Thank you.
And I'll answer your question, but allow me to say this. As an American, as a fellow American, what I'm involved in with a team of others is one of the most important things that I will do in my lifetime. When we look at maternal health, and actually from an international standpoint, maternal health, maternal mortality actually sets the standard or the baseline for health within that nation. So when I'm talking about maternal health, when we're looking at maternal health, and in particular, when we're looking at Black maternal health, there's a state of emergency, there's a public health issue, and there's a need for America to rise to the challenge and make a difference and make some changes. And one way of doing that I found is working on the Maternal Mortality Review Committee and the Illinois Perinatal Quality Committee is the action arm of the Maternal Mortality Review Committee. So allow me to elaborate. The Maternal Mortality Review Committee in Illinois has been around for a while. It was one of the first committees that actually reviewed comprehensively maternal mortality. It's a multidisciplinary group, and it has evolved through the years. Initially, when we first started in the early 2000s, we looked at cases as a maternal review, a health review. More recently, with the assistance and collaboration with the CDC, we look at our moms as a complex unit, looking at the social determinants of health, looking at her community, looking at her support systems, and looking at the environment in which she lives. And with that, we make recommendations to the state in order to improve health, ensure quality, and our ultimate goal is to eliminate disparities. So we review, we make recommendations, and then the Illinois Perinatal Quality Committee takes the baton and is the action arm. They work with hospitals throughout the state to actually develop process measures, to develop toolkits, to look at resources that exist within individual hospitals. And they actually assist the hospitals in executing meaningful projects.
Great, thank you so much for that, and thank you for the work that you do. Angela, Black Mamas Matter Alliance, if you could tell us, I would love to hear, and I think our audience would as well, sort of the origin story. What led to the organization's founding? And then sort of a second part question, what was it responding to when it started? And what does it focus on today, if that's changed or expanded in response to new challenges over the years?
Yeah, absolutely. First and foremost, thank you so much for having me and for inviting me to this wonderful platform and panel. I definitely appreciate everything that Dr. Jones just raised up, and really rooting this in an international perspective to say that maternal mortality is very much a significant global health issue. And unfortunately, maternal mortality is significantly a burden for Black people around the world. And of course, we know that now in the US. I would say that what brought us together to formulate the Black Mamas Matter Alliance, we really do have to, first and foremost, situate this public health crisis of maternal mortality into its historical context, and understanding that history has showed us that unfortunately, even the whole foundation of gynecology and obstetrics was founded on the bodies of Black women, the experimentation on Black women's bodies, the forced enslavement of Black women's bodies to overproduce and to use their bodies to really not only pump milk and produce milk for this entire nation, but unfortunately used for forced labor. And we have seen that manifest throughout many iterations of history, especially in this country. We know that even Black women's ways of childbearing and midwifery practice was also used and unfortunately misused throughout the years through the Jim Crow policies that further over-medicalize the practice of childbirth and pathologize pregnancy and childbirth, which has unfortunately led us to where we are today with the maternal mortality disparities that we see today. And our work in particularly bubbled out of movement. It bubbled out of the reproductive justice movement that was coined and led by Black women in response to some of the gaps that they saw in the women's health and reproductive rights movement, to say that not only for Black women in particular, not only do we believe that, yes, we should have choices around our reproduction, but we also want to be able to birth when and how we want to. We want to be able to even parent the children that we have in safe and violence-free environments. And that's really the, and then all of this is rooted in the human rights and Black feminism framework.
Right, and sorry to cut you off, but for your personal journey, as you were working in all of these different movements, of course, that intersect, what made you think, I need to start my own alliance? What was the thing that came together for you?
Absolutely. So, and in talking about reproductive justice in the movement, it wasn't just me by myself. It was definitely a movement space of multiple Black women who came together, again, in response to a lot of the injustices that were happening in our communities, and most specifically, the Black Lives Matter movement. So back in 2013, 2014, the Center for Reproductive Rights, along with Sister Song, Women of Color Reproductive Justice Collective, came together to really understand what was happening around maternal mortality in our communities. And this stemmed from a report from Amnesty International that sounded the alarm around maternal mortality rates in the US. And from there, we started the Black Mamas Matter Project, which out of that formulated the Black Mamas Matter Alliance. And so that's how we came about. But situating it in history and these movement spaces is very important to understand why we're here and why we do the work that we do.
Absolutely. Thank you for that. Thank you for all of that wonderful context. Our viewers, I'm sure, appreciate that deeply. It's sometimes hard to talk about contemporary policy issues in the United States when they're compounding over multiple generations and hundreds of years. So thank you for rooting all of that, multi-layered, complex history, and making sure that we shine a light on that as we talk about this issue that seems modern, and it is in fact modern. I'm going to stick with you for just a little bit longer, Angela, if you don't mind, and sort of, you kind of talked about the history and these sort of, I mentioned, compounding injustice over generations, but you did an interview, and I'm sure you've said it in many different spaces, but when you spoke to Self Magazine in particular, you were responding to this notion of individual blame. And oftentimes we hear people try to address inequities by saying things like, well, people don't have education, or people don't have access. If we can just get these mothers to know what to do better, if we can just get those kinds of things, it seems like you're responding to that because you said, no, these are systemic issues. Right? These are the failures of our systems, of our governments, of the policies that get pushed through and the policies that don't. And you talked about a broad environment, both social and environmental, as really being sort of the reasons why these outcomes are happening, at least mostly, and that trying to talk about individual responsibility and behavior change are sort of like putting Band-Aids on a gunshot wound. Could you just elaborate for our audience what some of these systemic failures are in the contemporary context?
Absolutely. So definitely also still want to go back and uplift what Dr. Jones had mentioned before, because I think that even what she had mentioned in the work that she does in Illinois is very, very valuable, and rooting that in social determinants of health, because that is actually what we really do need a lot of our public health and medical systems to do in their response to really starting to like peel back this very complex public health issue of maternal mortality, and to look at it from a systems change and systems and building new systems perspective. And so to further reiterate on that statement, we have had many decades of research that is rooted in behavior change, whether we're talking about chronic disease, whether we're talking about infectious disease, even in a lot of the past infant mortality work that has been done over the past 20 years. We have a lot of research that has shown us over and over again that we cannot just simply focus on individual behavior change, or simply focus on just creating opportunities for access to healthcare, especially when we know specifically for Black women, in terms of their experiences in the healthcare systems, those that do go through the healthcare systems, they are experiencing all things from racism to actual obstetric violence in the form of neglect and mistreatment that contributes to their maternal demise, unfortunately. And so when we specifically look at the examples of whether we're talking about Dr. Shalon Irving, Kira Johnson, Erica Garner, the most recent Sha'asia Washington, Amber Rose, and I hope I didn't just say her name wrong, but these particular cases of these women all came from different socioeconomic backgrounds. They all came from different educational backgrounds. All of them had actual access to healthcare services, but what actually contributed to their demise, unfortunately, is the mistreatment, disrespect, and obstetric violence they experienced once they were in the healthcare system, unfortunately. And so to say that the only way to address health disparities is for individuals to change their behaviors, we see that that is not that's not the solution, and that we have to do a lot more systems change and really getting at the root causes of these issues. Absolutely.
Who has more resources than people like Serena Williams, right? And you still have these types of outcomes. Scary, scary stuff. Dr. Robin, from your medical perspective, what do you see as, in the institution of hospitals, what do you see as some of the biggest challenges for improved care?
So allow me to answer that by saying, we cannot just look at in the institution of hospitals. That's a flawed, in my opinion, way of looking at this. We have to look at this systemically. We have to realize that health doesn't lie solely within the four walls of a hospital. We have to realize that everybody has a part to play. With that being said, that would include the hospitals, the government, the insurers, the providers, the community, and working with our patients and their families to further empower them, to further make them feel like they are being listened to, and to further help them to understand what their body is trying to tell them. So everyone owns it. A hospital is a segment of that ownership. And yes, hospitals should have quality committees. Within that quality committee, when they're looking at quality, there is no quality without equity. Therefore, they should be looking at their data from a race and ethnicity standpoint also. So before I stick out my chest and say, I am the best or one of the best hospitals or organizations in the United States, I would love to see your quality data as it relates to race and ethnicity. And that's one of the things that the Illinois PQC is doing. We're saying, let's look at all of your data, and part of your metric should be to break down that data in terms of race and ethnicity so that we can determine collectively your opportunities.
Are many hospitals looking at, are there quality committees reviewing, sort of auditing across race and equity?
I would say historically that is not the case. It's more collective. Are women dying from A, B, and C, or is there severe morbidity associated with A, B, and C? I would say moving forward, there's an emphasis for states to do that, but we have to come up to the plate and actually execute.
So that's one of the biggest changes that needs to happen at the hospital level.
One of the biggest changes is, that's one. The other is identifying women. So that's the quality, one of the quality initiatives. The other is making sure that you can connect women with the necessary resources, mental health resources, substance use disorder resources, resources for domestic violence, resources for specialists. Once again, hospitals don't own it all. Insurers and the government play a role in that also. And then when a woman comes into the emergency department, ensuring that your physician or provider asks the question, have you been pregnant, or are you currently pregnant, or have you been pregnant within the last year? Because just asking that question can lead you down a different path.
Right. Thank you so much. We talked about a lot of the problems. We talked about historical problems, systemic problems, and how there has to be a multi-pronged approach to making this, this disproportionate impact disappear. And so now that we've sort of comprehensively discussed some of the challenges, I wanted to talk about some of the victories that you guys have been witness to. I want to sort of, again, break this question into two parts. First, some of your personal victories that you've experienced through the work that you do with your respective organizations. And then also just things you've observed that are changing in the field. Little incidences of, like, you know, a sort of example of a more systemic shift that might be happening, even if it's a minor one and we still have a long way to go. Could you guys share some of the victories and sort of some of the greatest, you know, shifts happening in your fields?
Absolutely. So, to be honest with you, I hope Dr. Jones is okay if I, you know, just kind of piggyback off of some of the things that she's mentioned, because I will actually lift up the work that she's involved in as a victory in terms of really seeing a shift with the perinatal quality collaboratives and some of the work that she's doing over there, because that is hard. It is very hard work. And definitely will uplift that example for some of our southern states and their perinatal quality collaboratives in terms of some of the things that they can be doing to shift how they go about doing this work and be more equity focused. And so to specifically talk about the work of the Black Mamas Matter Alliance, again, yes, thinking about the role of government and the role of insurers, one of our biggest push was around policy change. Number one, we are very excited and very happy around the victorious creation of the Black Maternal Health Caucus at the federal level, and a lot of the work that we've been involved in with several other Black-led organizations around creating or informing rather the different pieces of legislations within the Momnibus Act. And each piece of legislation seeks to address all of the major systemic issues around what's driving the maternal health crisis in the United States, not just for Black women, but that will be beneficial changes for Latino women, for Indigenous women, and even everyone else. And so there's bills around addressing exactly what was just said, social determinants of health, ensuring that state governors and systems understand their roles in addressing this, and to talk to not just Medicaid as an insurer or payer rather, but other private payers to be part of the solution. And then taking it further to think about how policy and the role of government and systems to open up the pipeline to create more opportunities for other perinatal health workers. Like what was just said, all of the solutions and changes, not just in the hospital setting, there needs to be more investments in the community setting. So we're very happy that there's a lot more focus and attention around, one, putting more investment into midwifery care, to building out more midwives, especially community-based midwives that look like the communities most impacted by these issues. Thinking about doulas, ensuring that doulas are not only part of the continuing of care perspective around when we think about postpartum care, but that doulas are incorporated even in the hospital system as navigators and working with providers in that process. Also, thinking about you know, all of the work that has been happening at the state level even for at least in the southern states that have been overburdened by the COVID-19 pandemic. Unfortunately, a lot of the hospital systems have been overburdened by that. And so it has forced a lot of our systems and our policy decision makers to rethink some of their regulations around birth centers and even home births. And again, thinking back to what can we be doing to further expand opportunities for the perinatal workforce, so that again, right, we know that doctors, OBs can't do everything. They need to be able to do this from a team-based approach. And so while there are these public health crises, they're opening up a silver line of opportunity, if you will, for us to be able to rethink, reshift how we approach addressing this issue. Again, from a systems-based, multi-pronged, multidisciplinary perspective that involves everyone, from a team-based approach and holistic approach to address these issues. So we're very excited to be a part of the policy, research, and service provision changes around these areas. And yes, that's what I would share. Thank you.
Thanks so much. And even just anecdotally, I've observed that doulas and midwives are more covered by insurance than they were, say 10 years ago. So thank you for the role that you've played in that and the other things that you've done to provide more care to mothers who are expectant and postpartum. Dr. Jones, some victories you'd like to share?
It was mentioned that the postpartum period at one time was considered to be 60 days after delivery. Well, with our studies, we realized that when you're looking at the postpartum period and when women are most vulnerable, yes, there's that 60 days, but there were a third of the women who unfortunately died as a result of pregnancy-related deaths outside of that 60 days. So one of the victories that we have is, number one, extending Medicaid coverage to 1 year versus 60 days. That's a victory. And not only that, we're working hard to impress upon other insurers that this is important. If almost a third of the women are dying from pregnancy-related deaths outside of that 60 days, action needs to occur. So that's one thing. The other thing is deep-rooted systemic things that are affecting us. So studies have shown, and we can quote probably 20 in 2020, that people tend to relate to people that they have things in common with. With that being said, if you look across the medical schools in particular, across America, how many people of color are going into the schools and, just as importantly, graduating and getting into residencies? So that's another opportunity that we're looking at. Ideally, I believe you have to start when someone is in preschool, but we have a committee that is dedicated to at least working with medical schools across the state to ensure that there is some initiative and passion to bringing vulnerable, underrepresented individuals into their schools. So that's another win for us.
Awesome.
I think that the public needs to know this. When Illinois did their study, one of the things that was most alarming, besides the disparity, was preventability. Over 65% of the deaths were potentially preventable. And I'm going to say that again so you truly understand what I'm saying. I said over 65% of the cases we reviewed, we felt that if some action was taken, there was a chance that that death could have been prevented. With that being said, there has to be action.
Right.
With that being said, and as we look at access, and access is still an issue, however, we have to address the fact it's not the only issue. And as stated earlier, when we talked about individuals versus groups of individuals. So if you are a Black woman, any socioeconomic class, you are 3 times more likely to die from a pregnancy or pregnancy-related death than your white counterpart. That's alarming. And what that tells us is there's something that's systemic that's going on. And so one of the things you said, what are some of the victories? One of the victories, I think, not just in my state, but we're having a conversation about systemic racism and how it affects maternal mortality. That's a victory.
Yeah, certainly is. Okay, my last question. What was that, Dr. Jones?
At least acknowledge that it's more than, for example, she needs a blood pressure cuff, or, which she does, or it's more than access. There's something systemic in America that's causing Black women to die 3 times more likely to die than their white counterparts. So that's a victory, but it's a victory, but let's not start running our victory laps yet.
Right.
We start with acknowledgement, now we need to put action to that acknowledgement.
Absolutely, absolutely. My last question for both of you before we start taking questions from our viewers and listeners is just simply share with everyone, you know, some things that they could do in their communities to get involved in this. Are there, you know, some legislation they should be looking out for? Are there some newsletters you recommend they subscribe to? How can they continue to, as you said, Robin, you know, do more than just speak about these issues and raise awareness? How do we move the dial? Could you share that with our audience?
Vote. I'm putting a period behind it. If you said to me right now, vote, and I don't need to say anything else about that, but vote. So I'm gonna start with vote. That's one thing. Next, women, your body speaks to you. Don't doubt yourself. Please, please understand that you deserve quality care. Don't doubt yourself. If you're not receiving that care, then please reach out either within that same hospital or to go to another hospital, and know that it's not just you. You're not imagining things. And I'm apologizing in advance for times where you felt something was wrong with you, and nothing was wrong with you. You were right on target. So listen to your body. We're working on having providers listen to you as you listen to your body. And community workers, insurers, intensive case management. Let's wrap our arms around these women who are vulnerable and in need of our care, because they are our sisters.
Angela, do you have something to add? Any suggestions for how people watching can do their part to make healthcare for women, Black women, especially maternal care, more equitable?
Absolutely. Definitely echo Dr. Jones. Please, if you're not registered, please register to vote. And also understand that voting is not just about this presidential election, it's about all of the people that's down the ballot, because it's that local and state level leadership that makes the most impacting your day-to-day life, that makes decisions around all things related to your hospital services, even around the quality of services that you receive, and especially the types of resources that comes into your communities, and especially as it relates to thinking about those resources that are outside of the hospital that we all need in our communities. And so voting is very important, both at the local, state, and national level. The other thing that people can do to get involved is, of course, they can follow us on social media. We have a wonderful newsletter that people can sign up for, which is on our website at blackmamasmatter.org. And the other thing is to understand that while we're talking about all of these issues, and it may seem like, doom and gloom, and like it's a lot of hard work, know that not only Dr. Jones is right, not only should women, and Black women in particular, know that you know your body, you have the solutions, know that there are Black women in leadership and in heads of these organizations that are advocating on your behalf and that are doing this work. And so there are so many ways in which that you can be involved too in this work. I want to lift up one of our other biggest victories is in the foundation of the Black Maternal Health Week, which was a national campaign that we founded in 2018. There was none of its kind. And the whole purpose of that campaign was to uplift and shift the narrative around Black motherhood from a negative perspective, and to uplift positive images, to say that Black women and Black girls do breastfeed, and that we've been birth workers and catching babies since the dawn of time. So we have the solutions, we have the holistic care that we seek and that we're looking for within our communities. What we need is the systematic support and resources to further model that and have that in all our communities. And so those are the ways that people can get involved. If you're very active on social media, there's a number of organizations that are doing even sister circles, finding ways to create opportunities for the everyday Black woman and her family to be together and involved, especially for new moms trying to navigate this system. So I would definitely say start there, but most importantly, if you don't remember nothing else, vote. Thank you.
Thank you. And I want to say to our audience, please make sure you send your questions in if you have any. We're still waiting to get questions from you all, and I know that our panelists are excited to answer them. I want to third, because Angela seconded, Dr. Jones, your take on advocacy, starting with you individually, that, the question was about how can we advocate, in our communities, how can we get involved in this broad struggle? And I just love that you started with be an advocate for yourself. I thought that was really powerful, so thank you for that. It's something that we forget to do. I think all mothers forget to do that, but perhaps especially Black women, given all of these systemic issues that we discussed in this conversation. Reminding us to advocate for ourselves is actually, unfortunately, very radical for us. Do you guys have any other comments, any other things we didn't quite get to that you really are burning to share?
I'd like to share something. And this is from James Baldwin.
Yes, please.
Let me say this with the passion that I envision he actually used as he was writing this. He said, Not everything that is faced in life can be changed, but nothing can be changed until it's faced. This is in our face. Now this is RLJ, that's me. This is in our face. We have the power to change it in the United States of America. We need to make it a priority. We can do this. Together, we can do this. Let's make it a priority.
Thank you for that. Last words from you, Ms. Angela.
Yeah, the other thing that I would just add to that is to also, I think it's important in the work that we do to talk about the definition in terms of how we define Black mamas, because it is rooted in some of these human rights frameworks. And I just wanted to share that while we are talking about Black women in particular, we are inclusive of Black birthing people who are gender nonconformative, but also African immigrants, Afro-Latinas, and Afro-Caribbeans, whereby, we get lost in the data collection and even in some of the stories that are that are talked about around this issue, because it does get a little even more complex when we think about even what's happening with our African immigrants in this country. And I had to lift that up even in this context because of some of the unfortunate things that are happening at the ICE detention centers around hysterectomies. And again, these continued instances of reproductive oppressive practices that as a human rights organization, we have to uplift and say, we have to stop it because it is contributing to the maternal mortality.
Thank you. We did get a couple of questions. Someone wrote in and asked, where are some resources for first-time moms to be, where they can use it as a reference to ensure they're receiving the best care, know what kind of questions to ask, all of that. Where are some places where they can go to find those kinds of materials?
Absolutely. I can just quickly uplift a few organizations that's part of our alliance. There's the Southern Birth Justice Network. They're out in Florida. They have a wonderful slew of resources on their website, everything from talking about how to even go about finding a doula, what are my Bill of Rights as a birthing person, and then also some resources for that first-time mom in the postpartum period. There's also Ancient Doula Services Network out in New York. They too have a slew of resources on their website. And again, excuse me, and if you just wanted to see a more broader listing of organizations that are culturally congruent and Black-led, you can go to our website under members. We have quite a bit of resources there for you to navigate.
Thank you. Did you want to add anything to that, Dr. Jones, in terms of resources for new moms?
I would also add, you can go to the Illinois ILPQC.org. Has a lot of resources for mothers, and actually ACOG, the American College of Obstetrics and Gynecology.org, has resources for moms also.
Thank you so much for sharing that. We have another question. It's more of just an invitation to share more about the history of doulas and their ongoing importance. For both of you.
Yeah, so I wouldn't consider myself a complete expert on doulas and could speak to all components of it. We have members in our alliance that, excuse me, are focused on doulas and training doulas, but definitely what I can quickly say, let me get to the point, the quickest thing I could say is that doulas are really excellent not only patient advocates, but patient navigators of the healthcare system in general. Typically, it's recommended that once you do know that you're pregnant and that is a pregnancy you want to see through, that you seek out some kind of doula service. Sometimes, depending on the hospital system or your insurance provider, they can actually have references and recommendations of folks for you to follow up on. But as I mentioned, those resources before in terms of Ancient Psalm Doula Services, Southern Birth Justice Network, they have resources and more specific information around doulas, all of the work that they do, and how you can get connected to doula services. One last reference that just popped in my mind is the National Black Doula Association. They actually have a comprehensive referral list of doulas all across the nation. They are also a resource.
Dr. Jones,
The only
any
thing
comments about the role of doulas?
I would just ditto what Angela said, and I agree with her wholeheartedly. They are professional, they are advocates, they're well versed in pregnancy, in this case in pregnancy. So for those of you that feel that this is something that you either don't know about, or for those of you that are saying, I want to look at all of my options, I would welcome you. Please, Angela outlined some of the resources. Take a look.
Okay. I think that's all we had time for in terms of questions. Thank you all to the questions that were submitted. As I wrap, of course, I want to make sure that I thank you both again so much for your time today and for sharing the history of this problem, really helping to illuminate for our audience how systemic it is, encouraging them to not be discouraged by how systemic and complex it is by sharing these victories. And thank you so much, of course, for the work that you do every single day.
Thank you for the opportunity. It's a pleasure.
Thank you.
Thank you.
To our audience, please check out the center's upcoming events and do not forget to vote.